Speaking of wellness and spreading the word about staying fit, an international conference on health promotion just wrapped up in Shanghai. I spoke to Dr. Kate Tulenko about the significance of the meeting. She's a global health specialist.
This meeting is significant for a number of reasons. First is that it's on health promotion. Health promotion is the enabling and empowerment of people and communities to take care of their own health. Usually when we talk about health, we talk about clinical care, which can be very passive. People receive medicines, they receive procedures, but this is about people being actively involved in their own health. And then another reason it's important is because it's looking at the Sustainable Development Goals, which are the UN's goals for itself and all the countries in the world to promote development, and looking at how we can improve health across all the SDGs. There's only one SDG that looks particularly at health, but all the others affect health and are affected by health. And then the last reason it's significant is its meeting in China. China is one of the first countries that will become old before it becomes rich. The countries in Europe and North America, which have large aging populations, are upper income countries. China is a middle income country, so they'll have to be very creative of finding cost-effective ways to promote health in the elderly.
And when it comes to promoting health, is this about brainstorming, exploring ideas, or are we going to see tangible commitments here?
It's a little bit of both, but there are tangible commitments coming out. One is the mayor's declaration on healthy cities. And this is important for a number of reasons. The world is rapidly urbanizing. In fact, in 2014, that was the first year that the majority of the world's population lived in cities. And actually, the majority of urbanization that happens from now on will happen in developing countries. So it's a developing country issue. And urbanization has positive and negative things for health. On the positive side, people live closer to health facilities so they can access care. Also, people in urban centers tend to be more educated, wages are higher, and women are more empowered. These all lead directly to better health. But on the negative side, there's more stress, more pollution, more interpersonal violence in urban areas. Also, there's greater access to junk food, sugary foods. There's more obesity because of that. Also, more access to substances abuse, such as tobacco, alcohol, and drugs.
And WHO Director General Dr. Margaret Chan has talked about some of the things you mentioned. She's called on global action to protect people from health risks, provide access to healthy choices, spreading awareness, and really how to be and staying healthy. But Dr. Tulenko, is this easier said than done? And how practical, how realistic is it when you're talking about developing nations?
Exactly. And some of the declarations that come out of this are trying to be actionable. So in the mayor's consensus statement, there's an actionable list of reducing pollution, not just to do it, but how to do it, making women safer, also engaging people more, and having what's called good governance. So, for example, whenever a city makes a decision, for example, on traffic or transport and wages, they consider the health implications of that decision and try to maximize the health. So yes, they're trying to be very concrete and actionable.